Hi, I'm Laura Heerman-Langford from Intermountain Healthcare, and I am visiting with Stan Huff and Russ Leftwich this afternoon about HL7. Would you both introduce yourself, please?
Hi, I'm Stan Huff. I'm Chief Medical Informatics Officer at Intermountain and also the Chair of the Board of the Healthcare Services Platform Consortium, and very active in HL7 and a co-chair of the Clinical Information Modeling Work Group within HL7. Yes.
I'm Russ Leftwich. I'm a Senior Clinical Advisor for Interoperability for InterSystems. I'm also active in HL7 as a member of the board and co-chair of the Learning Health Systems Work Group and the Clinical Interoperability Council.
Great, well, welcome. So can you tell me a little bit about HL7 and why should clinicians care?
So HL7 is a volunteer open consensus standards development organization, and their goal is to make data interoperable, make data available everywhere, the right data to the right person at the right time, so that we can provide higher quality, lower cost health care. And one of the, I think, most exciting things that we've had going on in HL7 in recent times is the FHIR standard. FHIR stands for Fast Healthcare Interoperability Resources, and it's an open API that allows you to standardize how you access and store clinical data around patients. And so we're excited about that.
So FHIR was created 5 years ago, or proposed in answer to the question that was asked of a HL7 task force: what if we created a new standard from scratch? What would it look like? And FHIR was created with the technology that's the basis of other businesses that have been transformed by their ability to access data across different systems on the internet. Social media, e-commerce, travel websites, and FHIR is that same technology applied to healthcare.
So why should clinicians attend the Partners in Interoperability meeting?
So the Partners in Interoperability meeting is being held on March 21st and 22nd in hosted by Georgia Tech in Atlanta. And a couple of things that I think are important. One, we want clinicians to understand more about FHIR and why it's important to them. And the really kind of summary statement would be because it can help them get data that they need and provide better care because of the use of that standard. We want clinicians to be involved because for that to work, we need support from clinicians and vendors and software developers, and in the end it's clinicians who will create the desire and motivation for people to adopt FHIR and to have it succeed. I think the other reason that we want clinicians there is that an important theme that we have is not just about the technical aspects of moving information, but getting clinicians across different specialties to agree and know and use the same standards, so that we don't have one standard for pediatricians that's a different standard from adult medicine, different from surgery, and we certainly want the nurses and the physicians to both talk in the same way. And so we want to start and get people engaged in talking about standardizing the kind of data we need across all of medicine rather than just in some small pocket.
Russ?
And it's also an opportunity for clinicians to learn what clinicians in other organizations are already doing with FHIR in their organization, in production, and finding value even in an early version of FHIR. Because it allows them to do things with the data in their systems that they couldn't do before.
Great. Can you give us just a high-level taste of what the topics that will be covered at the meeting?
So it will be the things that we've been talking about. We'll be talking, telling them about fire, talking about ways that people have already been using fire. Just to mention, very interesting things going on at Duke University. Ken Kawamoto at the University of Utah is doing some great work. We can talk about that. We've done some things at Intermountain Healthcare that we can share with people. And then we'll be talking about the need to standardize data across all of medicine as opposed to just within some small segment.
Anything you'd like to add?
Well, I think we want to get them as excited about fire as many of us are, because it has provided so much value, and the F in fire is for fast. It's been fast for people to learn, fast for people to actually implement in their organizations, and fast to see produce value from using fire applications.
Great. Is there anything else you'd like to share that you think potential attendees may get out of the meetings?
Well, it's always a great opportunity to share ideas and information, to network. I guess that's the kind of buzzword, to network with other people who are involved in standards, to know and understand, create new relationships. It's been my, I guess, lesson or perception that much of what we get done is because we know people and we trust people and through relationships. And so it's an opportunity to create some new relationships, get to know some new smart people, share some ideas. So that's another reason I think that would be a good reason to come.
Great.
Yeah, I think that's the absolute top level value, is to be able to meet these other people that are doing things with fire and to share both what's been done and ideas for what next.
Great. Well, thank you both for joining us today, and we hope to see everybody join us at the HL7 Partners in Interoperability meetings. Thank you.
Thank you.